Hi there. My name's Jennifer. I'm the pharmacist here today. What can I do for you today?
I'm just here dropping off this prescription.
Okay. And you're Nancy Smith?
I am.
Okay. And just to verify, and you've been here before?
I have.
Okay. Just to make sure I have the right person, what's your birth date?
August 1st, 27.
Okay. So I guess just to make sure that I have all the correct background information, is it okay if I just ask you a few questions?
Yeah, sure.
Okay. So what other what medical conditions do you have?
I have osteoporosis and I have high blood pressure.
Okay. And what other medications do you take?
I'm taking amlodipine, I'm taking hydrochlorothiazide, and then I'm also taking alendronate once a week.
Okay. And do you take any other over-the-counter medications at all?
I take those calcium chewable caltrate tablets, or whatever they are. Yeah.
And any other herbal products?
No.
Okay. And do you have any allergies to medications?
I'm allergic to sulfa.
Okay. And what happens when you have a sulfa?
I had it about 30 years ago and I experienced a rash.
Okay. It was quite a while ago. Do you remember the rash at all?
No.
No? Okay. And have you had a sulfa since that time?
No.
Okay. So it looks like the doctor prescribed Macrobid for you.
Mm-hmm.
What's the prescription for? What are you taking it for?
Well, I went to the walk-in clinic because I was having to go to the bathroom quite frequently. It was painful when I went to the bathroom. Usually I have to get up only once throughout the night to go to the bathroom, but now I'm having to go up 3 or 4 times.
Okay.
I've started to get really sweaty this morning and just feeling really hot and having pain as well.
Okay. Whereabouts is the pain that you're feeling?
It's in my lower back.
Okay.
Yeah.
Is it anywhere else or just pretty much the lower back?
Just the back.
And then when you're urinating,
it's really painful, yeah.
Okay, so have you taken your temperature at all?
They took it at the walk-in clinic. It was 38.5.
And what did the doctor say that you had?
He didn't really say anything, to be honest. It was a walk-in clinic. It was in and out. He gave me that prescription.
Okay.
Yeah.
And then he just gave you this? He didn't
say anything, no.
Okay. So when did the symptoms start?
They started 2 days ago. I've been having to go to the bathroom quite more often 2 days ago, but this morning is when I really started to get really sweaty and the pain started.
Okay. So this morning is when it got worse and you got the fever?
Yeah.
Okay. So usually we use the Macrobid for a urinary tract infection. Usually just one that's not too complicated. It's just in the bladder. But by the sounds of your symptoms from this morning, it seems like it's kind of moved into like your kidney area. So it gets a little bit more complicated. And we usually use something a little stronger, like a Cefixime or something like that. It's just probably going to get into those tissues a little better to kill off the bacteria that's in there.
Okay.
And just because of the fever, it does seem like it has moved up into the kidneys. So if it's okay with you, I'd like to change the prescription, just because I don't think this will work as well as something else will for the higher severity of your infection right now.
Okay.
So I think if we give you Cefixime 400 milligrams daily, and this one was just for 7 days, but I think we'll treat yours for 10 days just because it is more severe than just a regular bladder infection. Have you had one of these infections before?
Maybe in the course of my lifetime, but nothing that I recall.
Nothing that you would really remember?
No.
Like nothing that's been this severe before?
No, yeah.
Okay. And have you had any antibiotics in the past 3 months or so?
No.
No other infections. Would you be comfortable if I change the medication
Yeah,
for you?
I just really want something that's going to work because I'm in a lot of discomfort.
Yeah. Have you tried anything for the pain? Have you taken anything for the pain at all?
No.
No. So usually when someone has a fever, you could have like a warm bath. You don't want to take a cold bath just because it won't be very good for you. But if you take like a lukewarm bath, or if you have like a cool cloth and you just dab it on your face. And sometimes we recommend eating popsicle or something. I don't know if you like things like that.
Okay.
And you could try Tylenol for the pain.
Okay.
Just because it does sound like it's pretty severe. The antibiotic probably won't take the symptoms away for 2 days or so.
Okay.
So you could try the Tylenol for the pain while this takes down the infection.
Okay.
So would it be okay with you if I phoned you in maybe 2 or 3 days?
Sure.
Just to make sure that this is working and that the infection is going away. And if you feel that you're getting any worse or it's not getting better at all, in that time before I call you, make sure you call me as well and we can get that straightened out.
Sure.
Just because we want to try to get this taken care of as soon as we can.
Okay.
And we don't want you to be in discomfort for much longer.
Right. Yeah.
And try to get you back to being able to sleep a little bit more through the night as well. Yeah, I guess if I can call you in the 2 to 3 days,
Okay.
does it matter? Is there a particular day that you would prefer?
Doesn't matter to me.
Okay. So yeah, if you feel any worse or if you want something to work a little bit better or sooner for you, just give me a call in that period. Otherwise, we'll talk to you in maybe 3 days.
Okay.
Okay? And that's okay with you?
Yeah.
Did you have any questions at all?
How am I going to take the medication?
Okay, so you're just going to take 1 tablet once a day. So
Okay.
you can take it, I guess some of the side effects, it can cause upset stomach.
Okay.
So, and you can take it with food. So it's just once a day. So maybe take it in the morning with your breakfast
Okay.
every morning, and
Okay.
for the 10 days.
Okay.
And you should see some relief in that about 2 to 3 days or so.
If I feel better in 3 days, can I just stop?
You shouldn't stop just because if you stop too early, we have like resistant organisms, so that means that it's harder to treat and less antibiotics will work for that. So we usually like you to take it for the full 10 days.
Okay.
If you see like a rash or anything like blisters on your body, you should stop taking the medication just because you could be having an allergic reaction.
Oh, okay.
So stop taking it at that point, and then call me or contact your doctor,
Okay.
and we can get that sorted out.
Okay.
Did you have any other questions?
No.
Okay, so I'll talk to you in 3 days or so.
Okay. Sounds
Okay.
good.
Have a good day.
You too.
I would buy my prescriptions from you. The amount of writing bothered me, but I now understand that that's more for DAP and whatever else.
Yeah.
So whatever. I wrote down excellent process, and then I wrote down slow, and I changed that to methodical. Okay, because you were listening, but just nice, simple process, very clear, very concise. I loved it. It was great. Your explanation of why you were changing the drug was right on, very easy for an 86-year-old lady to understand. What have you tried? You said you gave her some non-farm products. You brought up the Tylenol even before she had a chance to mention. I agree 100% with your follow-up. You call her in 2 days. I think you said that.
3 days.
Or 3 days. Call her. This is the time when it is necessary for a pharmacist, or it is. I would certainly hope a pharmacist would follow up. There's a lot of products and a lot of things you dispense. You're not going to have time to follow up with every customer you have. This is one case where I think you should, because of the age, because of the severity, where the condition is escalating. You want to make sure things are under control and you're using the right thing. Is there any follow-up lab required on this case?
I didn't think so, but I can't. Do you remember?
I think if it was pyelonephritis, you have to do initial culture and sensitivity.
And that's
Oh, it's
It's all
probably-
there.
it's
Okay.
in there.
Yeah,
There's
so
there. Okay.
only if there's reinfection you need to do a follow-up, not otherwise, I think.
You pick it up from them on.
Okay, so yeah, based on what we've talked about, that seems correct. No, I think you did a really good job. I'm really impressed. You're probably one of the best pharmacists I've had today.
Thanks.
Like, I felt really, you knew what you were doing and you weren't rushed, and like your process is built in you now. Like, I can tell it's not like, you know, other people are still having trouble with it and missing some things, but you have it down, so good job. I feel that you could probably go into any consult and do it even if you had no idea because of your process. So
Okay.
keep that with you. It was
Thank
really
you.
good. One of the things is after you've kind of gone towards the end, what I like to do is I like to summarize, because then I know what I've missed. So after you've done a good med history, you've done scholar, you've assessed the problem, you've solved the problem, well, you need to explain the actual medication. That's what I kind of brought
Right.
back to
Yeah,
you.
thanks for
So
that.
yeah, so definitely, like, one thing that helps me to remember that is summarizing at the end. Okay, so we've talked about how this medication that was prescribed wasn't inappropriate. I've switched it, and then it kind of signals me, well, I actually haven't explained side effects. I haven't explained
Right.
if the medication, when is it going to work, and that kind of stuff. So definitely maybe summarize at the end, and that will kind of flag you to do that. But that's so minor compared to how excellent your process was and stuff. And then, yeah, just being really specific as you were about your follow-up. So I'm going to follow up in 3 days to assess if the medication is working, if you've experienced any side effects, and then also to confirm that the medication we've chosen is right, because right now I don't have the cultures. They're still pending.
Yeah.
When they get back to you in 3 days, I'm going to confirm that they're the right ones. If they need changing, we'll do it from there. If not, it'll stay the same.
Okay.
So just be really specific and close off. But yeah, really good job.
Thanks.
Yeah.
Anything you want to throw in?
No, it was the same. I just had for start doing, I don't know if it's important or not, but just the social history, so say if she lives on her own or if she lives in a long-term care facility, that might change how you take your medication or something like that.
Yeah, like if she
Yeah.
takes blister
Yeah.
packs and
Yeah,
stuff.
or
No,
if
that
she can
could be-
take her
Yeah.
meds with the other 10 meds she might be on or stuff like that.
Yeah.
Yeah, just all that, but otherwise it was awesome.
Yeah, it was. It was very good. Enjoyable. Yes.
Thank you. Yeah,
So-
you helped me out there at the end. So
Yeah, but I won't deduct. I'll deduct marks from her for leading the witness.
Oh, I never actually